Welcome back to Neurodegeneration Awareness and Artificial Intelligence. I'm your host, Dr. Sukant Khurana. In our previous episodes, we have journeyed through the landscapes of neurodegeneration awareness and the burgeoning role of AI in regions like Europe, Middle East, Africa. Today, we turn our attention to a region with its unique tapestry of challenges and opportunities, South and Central America, including Mexico. To help us navigate this vital discussion, I am honored to welcome Dr. Kaneez Fatima, who is a neurodegeneration and pharmacology expert. Hello, Dr. Fatima. Welcome to the show.
Thank you, Dr. Sukant. It's a crucial conversation, and I'm glad to be a part of it.
Absolutely, Dr. Kaneez. Coming from our discussion on Europe, the nuances are there revolved around optimizing existing systems. Here in Latin America, the landscape presents a different set of foundational hurdles. What are some of the primary challenges you see regarding basic awareness of neurodegenerative conditions?
That's a critical starting point, Dr. Sukant. Across much of Latin America, we grapple with a significantly lower baseline of public understanding compared to many parts of Europe. Conditions like Alzheimer or Parkinson are often simply attributed to old age, and therefore early warning signs can easily be dismissed. This isn't just a lack of medical knowledge. There's often a cultural reluctance to acknowledge cognitive decline, sometimes due to stigma or sense of familiar privacy.
Well, that resonates with our earlier evaluation. And within this cultural context, the family unit plays such a central role. How does this impact the journey of someone experiencing neurodegeneration?
The strong familial bonds are both a strength and a potential challenge. Families provide immense, often unwavering support, which is invaluable given the limitation of formal care. However, this intense reliance on family can also delay seeking professional help. Moreover, the burden on primary caregiver, often women, can be overwhelming, leading to burnout and isolation. So, the concept of seeking external support or respite care isn't always culturally ingrained or readily available.
You touched on the limitations of formal care. Could you elaborate on the healthcare infrastructure challenges across the region?
The reality is a stark divide. We see pockets of excellent, often private healthcare in major urban centers, but the vast majority of the population relies on public systems that are frequently underfunded, understaffed, and lack specialized resources. Additionally, access to neurologists, geriatrician, and even basic diagnostic tool like brain imaging can be incredibly difficult, especially in rural areas. In addition to that, memory clinics or dedicated neurodegenerative disease centers are rare in the public sector.
Well, that scarcity of specialists must have a profound impact on the timely diagnosis and management.
Absolutely. The general practitioners are often the first point of contact, but their training in recognizing the subtle early signs of neurodegeneration may be limited. And this, coupled with societal tendency to normalize cognitive decline, leads to significant delays in diagnosis, often until the condition is quite advanced.
And what about financial burden on families? We discussed how limited public funding and insurance options are.
Sadly, it's a major crisis for many families. Long-term care is overwhelmingly an out of pocket expense. Then public financial assistance is minimal, and comprehensive insurance coverage for chronic neurodegenerative conditions is rare for the general population. So this financial strain can prevent families from seeking even basic medical care or accessing necessary medications and support services, which further exacerbate health inequities.
Well, given these significant hurdles, how do you see the potential role of artificial intelligence in this landscape? It seems the focus might need to be different than in regions with more established infrastructure.
Precisely. In Latin America, AI's potential lies in its ability to bridge fundamental gaps. We need to think about solutions that can overcome the lack of specialists and limited access to diagnostic. For instance, AI powered tools could assist general practitioners in identifying individuals at higher risk or flagging subtle cognitive changes that might otherwise be missed.
Yeah, I think that's a very important point that you mentioned. Using AI as kind of initial screening tool where specialists are scarce.
Exactly. Imagine AI algorithm analyzing basic patient data or even simple cognitive assessment administered in primary care setting to provide general practitioner with insights and guide referrals when necessary. This could significantly reduce diagnostic delays, especially in underserved areas.
What about data collection? We noted that inconsistent data is a challenge. Could AI play a role there?
Absolutely. AI could be instrumental in establishing more robust data collection system. Natural language processing could be used to extract valuable information from existing medical records, even if they are not perfectly structured. Then AI could also facilitate the development of standardized digital assessment tools that can be deployed more widely and generate consistent data for research and policy planning.
Yeah, and considering the small, very important aspect, the strong family caregiving tradition, could AI offer any support there?
While we need to be mindful of digital literacy and access, there's potential for AI powered tools to provide caregivers with information, connect them with online support network, or even offer basic guidance on managing symptoms. However, these solution needs to be culturally sensitive and accessible to those who may not have consistent internet access or high level of digital literacy. So these tool needs to be simple and affordable.
You've raised very important points of what kind of deployment will really work. So now ethical considerations are paramount in any AI deployment, but perhaps even more so in a region with existing health inequities. How do we ensure AI doesn't exacerbate these disparities?
That's a crucial question. As I said, we need to prioritize the development of AI solutions that are affordable, accessible, and culturally appropriate for diverse population within Latin America. This means involving local community and healthcare professionals in the designing and implementation process. We also need to be vigilant about data privacy and ensure that AI algorithms are not biased against certain demographic groups. Then open source AI model and collaborations could be particularly valuable in this context.
Finally, what role do you see of policymakers in fostering this kind of integration of AI for neurodegeneration awareness and care in Latin America?
Policymakers have a critical role in recognizing neurodegeneration as a public health priority and allocating resources for research, awareness campaigns, and development of appropriate technological solutions. They need to create regulatory frameworks that encourage innovation while safeguarding the patient's right and data. Then there is need of investment in digital infrastructure and training healthcare professionals in the use of AI tool will also be essential. Then again, international collaborations and knowledge sharing can be immensely beneficial.
Yeah. So, Dr. Fatima, this has been an incredibly insightful discussion, highlighting both the significant challenges and promising potential of AI to make a real difference in the lives of individuals and families affected by neurodegenerative diseases in South Central America as well as Mexico. So, overall, basically, Latin culture with both Spanish and Portuguese uh, dominance in terms of language. What is the one key takeaway you would like our listeners to have?
That while the challenges are substantial, there is still immense potential for innovation, particularly through the thoughtful and equitable application of AI to bridge the existing gaps in awareness, diagnosis, and care. And by focusing on accessible and culturally relevant solutions, we can begin to improve the lives of millions affected by these conditions in this region.
Okay, this is a very powerful message of hope and a clear call to action. Dr. Fatima, thank you so much for sharing your expertise and perspectives with us today.
It was my pleasure, Dr. Sukant.
And to our listeners, thank you for joining Neurodegeneration Awareness and Artificial Intelligence. We hope today's discussion has shed light on unique contexts and opportunities in Latin America's fight against neurodegenerative diseases. Join us the next time as we delve deeper and we put our lens on some other region of the world to understand neurodegeneration awareness across the world. Thank you. Please subscribe and like and share our podcast. Bye bye.